I'm Dr. Neil Galindez. I practice at HCA Florida Heart and Vascular Care. Patients are at 5 times increased risk of having strokes because of the atrial fibrillation. And what happens is that the chambers, the upper chambers of the heart, the atria, are quivering and the blood is not flowing in a normal pattern the way it's supposed to be. So when the blood gets stagnant in certain areas of the heart, that creates clots. So that's why patients with atrial fibrillation are more likely to have strokes, because those little strokes, sometimes those little clots sometimes go up the brain and cause strokes. So patients need to be on anticoagulation. In the last about 10-15 years, new technologies have evolved and new treatments have evolved for atrial fibrillation. Atrial fibrillation is very hard to treat. Again, the more you have it, the more persistent and harder it is for doctors to treat it. So what we have now is technology that combines two specialties, the electrophysiologists and the surgeons. Electrophysiologists do a more traditional procedure, which is base catheter therapy, which a catheter is inserted in the groin of the patient. It follows the track up to the heart, and they can ablate or burn certain areas where the abnormal impulses are coming from. When you have a kind of chronic atrial fibrillation, then it is of benefit for the patient to combine the two specialties. What the surgeon does is get, with minimal invasive surgery behind the heart, do kind of a similar procedure that the electrophysiologists do, but with a special catheter and from the outside of the heart. You do the ablation, the burning of the abnormal impulses from the outside, and then the patient goes to the electrophysiologist for them to do a more traditional catheter ablation from the inside. These two procedures combined have shown to render better results for patients.